Hey there, welcome to a Smart Functional Fitness channel. Today I'm talking about a very important topic. The reason is quite a few times when you are dealing with pain, you get the x-ray, MRI or a CT scan and the only diagnosis you get is arthritis. You are prescribed medications, maybe some physical therapy, but instead of your symptoms getting better, they get worse. You may start experiencing pain in the different parts of the body. You start feeling fatigue, lack of energy and inflamed in general. And you start wondering, really? Am I diagnosed right? What if I have some other kind of arthritis? Let me know in the comment if that's you and we can have a real conversation there. But let's talk about the difference between the osteoarthritis and the rheumatoid arthritis so you can get the proper treatment you deserve, okay? I'm Dipti Patel. I'm a founder of Therapeutic Pain Relief. I combine nervous system retraining along with the therapeutic mobility for a long-lasting relief. So now watch until the end because I'm talking about how can you treat osteoarthritis differently from the rheumatoid arthritis. Okay, so first is the osteoarthritis. There is a mechanical wear and tear of the joint. That's what happens in the osteoarthritis. Versus in the rheumatoid arthritis, it is an autoimmune disease, and as the immune system attacks your own body's own cells and tissues, specifically the synovium of the joint. Okay, in the osteoarthritis, it mostly related to the aging and degenerations. Pretty much every human being on the planet Earth has osteoarthritis at some point in their life. Now, rheumatoid arthritis, on the other hand, is a chronic systemic inflammatory disease. Okay, it's a systemic, it affects your entire body, not just one body part. In the osteoarthritis, it's mostly the joint pain, the stiffness, maybe some other systems involved, not much. But in rheumatoid arthritis, the symptoms are usually swollen joints, stiff joints, pain, fatigue, lung inflammations, the nodules on the skin, fatigue, feeling feverish, sick, or vasculitis. That happens occasionally. The osteoarthritis affects elderly people, especially people over 65. Rheumatoid arthritis affects people under 40 to 50 years of age. Osteoarthritis affects both male and female equally. Rheumatoid arthritis affects mostly women. So 2-to-1 ratios in male and female. In osteoarthritis, the x-rays will show noticeable wear and tear of the weight-bearing joints. That's your knee, hip, or maybe an ankle, or sometimes the shoulder. The rheumatoid arthritis, it usually affects the small joints of the hands. They get swollen and deformed. Okay? So the key is you're looking at the entire cluster of the symptoms, not just one thing in the rheumatoid arthritis, okay? So if you have X, Y, Z, then maybe you have a rheumatoid arthritis. Let's talk a little bit more about rheumatoid arthritis. I know that's the reason you are here. So there are several stages of rheumatoid arthritis. In stage 1, which is the earliest stage, which is difficult to diagnose since nothing is going to be visible under the x-rays, okay? In stage 2, there is some evidence of bone thinning in the x-rays and there are some joint deformities. However, the joint deformity or the mobility is kind of limited in the second stage. Stage 3, using the x-rays, bone and cartilage damage is evident. The joint deformity and muscle atrophies are evident. And in stage 4, which is the last stage, you will see a significant bone and cartilage damage. You will see significant muscle atrophy. You will see osteoporosis and ankylosis. Now, typically the symptoms of rheumatoid arthritis is a swollen joints. There is an accumulation of fluid in the ankles, morning stiffness, joint pain, fatigue, redness, increase in sensitivity to the eyes. You have dry skin, inflamed lungs, nodules on your skin. Those are the cluster of the symptoms of rheumatoid arthritis. Now, the exact cause of rheumatoid arthritis is unknown, but sometimes the immune system mistakenly attack your own joints. Okay, there is a huge genetical factors involved here as well. So how do you get diagnosed? So main thing is a physical examination. and there is not a single test diagnosed that you have a rheumatoid arthritis for sure or not, okay? So you have to go through the whole cluster of the things. So first is there is a subjective questionnaires. There is a blood test. The blood test will show the rheumatoid factor, erythrocyte sedimentation rate, the ESR. ESR will determine the presence of inflammatory mediators in your blood. The X-ray, which will identify the extent of damage in the joint. Sometimes the MRI gonna help you to find out the severity of joint conditions. And the last thing is, which is not necessary, but it's called arthrocentesis. So the procedure where they take out a little bit of fluid, joint fluid, to determine what are the causes of the symptoms, okay? Now $1 million question, how do you treat osteoarthritis differently than a rheumatoid arthritis? Now, first of all, osteoarthritis needs to be consistent joint mobility work and muscle strengthening to support the muscles. More joint has, the more support, gonna have less wear and tear. Remember, doing all this thing will not reverse the changes in the joints. It will help you to slow down the process of the arthritis, and the injections and the medications for the osteoarthritis is total BS in my point. One more thing, in focus on a function, okay? When you're dealing with the osteoarthritis, a lot of people blame all their pain in the osteoarthritis, but pain is multifaceted. Only taking care of the painful body part not necessarily gonna give you a pain relief. Even I have seen 30 to 40% people after a joint replacement experience the same amount of pain, even the entire joint is replaced. So where on earth the pain is coming from? Think about that for a second. Now let's talk about the rheumatoid arthritis treatments, because it's a whole different story. In my opinion, there is no cure for rheumatoid arthritis at this point. Yes, there are some medications can help you to mask your symptoms, can help you to manage your symptoms. Being said that, approaching rheumatoid with the holistic approach is a key. When you eat nutritionally dense anti-inflammatory food, work on your sleep hygiene, stress management, get some regular aerobic exercises, and don't strain too much on those painful joints on stage 3 and stage 4 when your joints are deformed, all that stuff's gonna help you to manage that so much better. Well, if you love this video, subscribe and share this video if somebody you know that can benefit from it. And if you have any personal tips or success stories, please drop in the comment below. I would love to hear from you. Okay, until next time, stay strong, stay informed, and keep fighting for a pain-free life.